Thank you all for attending tonight. Uh, Full disclosure, this is a little strange, even after 2.5 years of COVID, to be giving this type of a talk on the computer. So I hope it goes well. I have a lot of slides. I'm going to try to keep up a pretty good pace because there's a lot of pictures, a lot of things to see, and a lot of information. And like Rochelle said at the end, hopefully we can get to some questions. So I'm a vascular surgeon, like you heard, graduate of University of Michigan, go blue. I spent 11 years training at Stony Brook in Long Island. That's how long it took me to become a vascular surgeon, believe it or not, in this day and age. And I did a senior fellowship in minimally invasive vascular surgery at Texas Tech. So here I am back in New Jersey, mainly because my wife is from Paramus. And it's odd not hearing everyone because usually that gets a chuckle from people. So moving forward, we're here to talk about varicose veins. We're going to go over several things: causes, what kind of signs and symptoms varicose veins may cause or don't cause, some of the complications that varicose veins result in, how we evaluate people when they come to the office, and like a lot of people probably want to hear, how are we going to treat these things? Full disclosure, all the pictures of the patients you see here are my patients. So these are real outcomes and real patients in our practice. So just to bring everyone up to speed on the normal anatomy of a vein, our veins are designed to take all the blood from our leg straight back up through the leg and back to our heart. The way we're built, we have two systems of veins in our legs. We have our deep veins. These are very large veins. They're buried deep inside your muscle. You can't see them, you can't feel them. They're about the size of my thumb. They are not the cause of varicose veins. They have nothing to do with this problem. They are the ones you hear about people getting blood clots in DVTs, and that has nothing to do with varicose veins. We all have a second set of veins in our leg, and these are called the superficial veins, meaning they run under our skin. And there's one main trunk of the vein. The way we're all built, that superficial vein starts at our inside ankle. It runs up our calf next to the knee. It travels up our thigh, and right in the crease of our groin, it dives deep inside to join other large veins. This is not the main drainage of our leg. The reason our veins work so well, inside our veins are one-way valves. These are like little one-way trap doors. So when you're walking around and your muscles are pushing on your veins and pumping the blood, or when you're laying down and your feet are elevated and the blood wants to drain out of your leg, these valves, they flip open and let the blood go up. As you're sitting in front of your computer watching this presentation, gravity wants to push the blood down the vein in the wrong direction, and these valves close so that blood does not fall down the vein into your leg. That's the normal way we're all built. That's the way our veins are built everywhere in our body. What happens in some people, unfortunately, is those veins begin to malfunction. So instead of working properly by opening and closing, they start to flop in the breeze. When that happens, as you're sitting here in front of the computer, instead of all the blood efficiently going up those veins, it begins to fall down the vein in the wrong direction. That blood has to go somewhere. So what happens is, as that blood is now coming down in the wrong direction, it starts to spill out into all the side branches of the veins that are under the skin in our leg. And that's actually what you see as varicose veins. So the blue line represents that main, what's called the saphenous vein, runs under our skin here, like I showed you. These are all the branches that are filling because, unfortunately, in this patient, instead of the blood efficiently going up, as he's standing there over time, all this blood is falling into these varicose veins that are filling and are very visible. As we're going to show later on, the good news is we can fix these things. And this is one of my patients this year. This is his before picture. This is his after picture. So good news, although these things are bad, easy to treat. So what causes varicose veins? Well, age. People get them at a young age, and as they get older, they progress like any other problem. Women more than men. Genetics, it absolutely runs in the family. You hear it all the time. My mom had them, my dad had them, my sister has them. As I like to joke with my patients, this is the one time you absolutely can blame your mother for your veins. Genetics, like I said, it definitely runs in the family. People who are overweight, carrying extra weight, puts more pressure on our veins and leads to varicose veins. And then work and lifestyle. What I mean by that is on a daily basis, I see a lot of people who are nurses, hairdressers, postal workers, teachers, people who spend all day on their feet. As a result, oftentimes they wind up with this problem. And I'm sure some of you are the same way. So what do varicose veins do? Well, first off, and what I tell my patients as soon as I see them in the office, the one good thing about varicose veins, they're not dangerous. Regardless of what anyone else tells you, if you have varicose veins, you're not going to have a stroke, you're not going to have a heart attack, you're not going to lose your leg. However, besides being unsightly and a cosmetic issue for some people, they truly do cause aching and tired legs. The leg can begin to burn and throb. People get muscle cramps, especially at night. They cause leg swelling that can become a big issue for people. As these veins distend under the skin, what happens is they get so thin that the blood and serum and protein that's in the vein begins to actually leak out and get under your skin. It causes discoloration. It causes your skin to become itchy. And the worst result of that is the skin can actually break down into an ulceration. So this is what it looks like. Sometimes these things, like I said, are just cosmetic. That's a personal issue. Some people don't really care how it looks. Some people are bothered even by the smallest varicose vein. For some people, it does cause swelling, and that becomes a quality of life issue for people. Some people, as it progresses, like I said, the blood cells will escape and break down under your skin. And all of a sudden, your skin is becoming chronically and worsening discoloration like this. And the worst case scenario is the skin then begins to break down. And it's typically in the lowest point, which is around the ankle, because if you think about it, that has the most force of gravity, and the highest pressure in the vein is down by our ankle when we're standing. So when you come see us in the office, what do we do for you? Well, like a good doctor, we're going to take a good history. We're going to hear what's happening, how long this has been going on, what are the issues with it. We're going to do a good exam. Obviously, we're going to look at your veins. We're also going to check your arteries. We're going to make sure we're not dealing with a different problem, a problem of arterial blood flow, which can become a more serious, a more serious problem. Typically in the office, we'll do an ultrasound, very simple, a little gel and a probe on your leg. There's no needles, there's no radiation, takes a beautiful picture. This is what it looks like in the office. Typical varicose veins under the skin. This is how we measure the blood flow in the vein. And typically we see that this is a malfunctioning vein. So what do we tell people to do? Well, we tell people to exercise. That's good for your veins. That's good for your overall health. Losing weight helps. It takes more pressure off your varicose veins. Elevating your leg helps because that drains the blood and fluid out of your leg and usually makes people feel better. The one thing we tell people, and this is where we get the most pushback, of course, are compression socks. Compression socks are important no matter what you do with varicose veins. They compress the veins, they force the blood and fluid out of the leg, typically makes people's legs feel better. But none of these things, the exercise, the weight loss, the compression stockings, none of it is a cure. It just simply makes the situation more manageable and helps minimize symptoms. How about other alternatives? What else can you do to make your legs feel better? You know, oftentimes I think patients believe their doctors are against alternative or complementary treatments, and I embrace it. I think it's a good thing. When it comes to veins, we're big proponents of it. However, like I tell my patients, you have to be realistic. When you have big, large varicose veins or a swollen leg, or your skin is changing colors, all these things are not going to make your legs, quote, smooth and lovely again. but certainly can make your leg feel better. And for a lot of people, that's really what they're after. They're not worried about the cosmesis. They're worried about how their leg actually feels to them. Horse chestnut oil, it's been used for many, many years, very popular in Europe. Again, doesn't make your varicose veins go away, but for those people with very aching, tired veins, it actually can help them feel better. And there's been some pretty good scientific studies on it. So when people ask, I say, yeah, definitely try these things. I don't think there's a downside. Even in our office, we use certain products. We use Dermica, which is an all-natural cream. It's actually based on licorice, which helps with a lot of the discoloration of the skin that results from bad varicose veins. Vascular is an all-natural medication you can get from the pharmacy. You need a prescription for it. And in those people with very advanced varicose veins and really bad skin that has been discolored and thinned out from their varicose veins, these things, again, not cures, but they certainly can help. So probably what a lot of people want to find out is, well, how do we treat these? What can we do for our veins? We have a lot of different approaches. Some you may know about, some you may have seen. Family members may have had them, you personally. And certainly we can all read about them on the internet. So I'm going to go through them. And what I tell my patients is, even with all these options, the important part in treating veins is, one, if you make the decision to treat it, it shouldn't be because you think you're in danger. It should be because either you're having symptoms or, frankly, you just don't like the way they look. Both are legitimate reasons for having treatment. So we're going to go through these one by one. Sclerotherapy, most people know about. It's injection of medication into spider veins. Totally cosmetic. Because of that, no insurance covers sclerotherapy. It's a cosmetic procedure. It works very well. There's 2 FDA approved medications on the market that we use. Back in the old days, people used to hear about saline shots. That's before we had FDA approved medications, which have been around for a good 15 plus years now. We inject those directly into the veins, and what happens, those veins collapse, your body absorbs them, and they go away. This is a typical patient of mine. Over approximately a 3-month period, what I tell people is, if your leg looks like this, one treatment isn't going to do it. You got to be realistic. You can start to clear this up. You can get a lot of improvement. But this patient, this is multiple treatments to get you from here all the way to here. So it is possible. Everybody asks, and we'll see it with the varicose veins too. Well, gee, I heard if I just have sclerotherapy, they're just going to come back. Well, the veins that you sclerose will never come back because they're going to seal and get absorbed. However, nearby, are you going to get other spider veins? Probably over a lifetime, absolutely. But it is not the same vein that was treated before. And I'm going to show you that with varicose veins because we always get that same question. How about vein stripping? Everybody comes to the office and says, I had my vein stripped. Vein stripping at this point is simply historical. We don't do it anymore. It's brutal. It used to be very effective, but the good point is now we have a lot of better, less invasive ways of doing this. But just for completeness, the way it's done is this procedure of vein stripping, a true vein stripping, has to be done in the operating room. You have to have full anesthesia. You have to make an incision in the leg down by the knee, overlying the vein. You have to make another incision in the skin, overlying the vein up near the crease of the groin. And frankly speaking, the way this works is you pass a very fine wire up the vein through the 2 incisions. You attach it to the vein up here. And kind of like starting your lawnmower, you just pull real hard and the whole vein tears out. Hence the reason it's done in the operating room. Under anesthesia, patients used to spend at least 1 night in the hospital to recover from this. So although very brutal, a little bit tough recovery, very effective because that vein is taken care of forever. So the good news is in the last 20 years, I've never stripped a vein because there's much better ways of doing it. So these days, we do all these procedures in a very minimally invasive way. We do them what's called a catheter-based procedure, like you'll see advertised or read about. These things can be done with a laser, and some people call that laser surgery for their veins, or it can be done with a radio frequency transducer. And what we do for these procedures is very simple. It's done in the office. It's a local anesthetic. There's no stitches. There's no sutures. You come to the office. We prep the leg right down here in the middle of the calf, overlying this vein. We numb the skin, and we simply put a needle in the vein. After that, you don't feel a thing because our veins actually don't have nerves inside. With that needle in the vein, what we do is then introduce a catheter, which can be either a laser or, like I said, a radio frequency transducer. I tend to use a radio frequency transducer because it causes less bruising and less risk and discomfort after the procedure. So this catheter then goes into the vein through that needle. When we turn that catheter on or turn that laser on, that energy is going to zap the vein. It's going to seal it up so that when we're done, that vein now is collapsed. Your body's going to absorb it. It's going to go away. So instead of tearing this vein out like we used to 20 plus years ago, now very simple, you seal it up from the inside. Your body absorbs it. It goes away. That's all done with a local anesthetic. When you're done, you take the needle out. We put a Band-Aid on and an ACE wrap, and you walk right home. Very fast, easy recovery. Maybe an ice pack, maybe an Advil. That's it. Our other treatment for varicose veins is called the microphlebectomy, another office-based procedure. Again, it's a local anesthetic. There's no sutures, no stitches involved. What we simply do, and I'll show you a picture, it's a little bit easier to see. You simply numb this area. When the skin is all numb, we make a couple of punctures in the skin, and we actually tease these veins out, and they're gone forever. When we're done, we put some Band-Aids on and an ACE wrap, and once again, patients walk home. Very effective, very good results. Again, a patient of mine from the office, very dramatic. This is done in the office, a local anesthetic. After you numb this skin, people don't feel a thing. We put on some music, we talk, we chat. In the meantime, what I'm doing is puncturing the skin here, overlying these large veins. We tease them out, and they're gone forever. And you can see this result is probably about 6-8 weeks after the procedure. People always ask, well, aren't they going to come back? Well, they're not, because those veins, and this is an example, are literally going to wind up in my garbage can. So as a result, no, they won't come back. What I tell people, though, is once you've had varicose veins, just like spider veins, you are prone to get more varicose veins. So I jokingly say to people, I will see you again in 10 or 15 years, perhaps, when other veins in your leg decide to show up. And I've been doing this long enough. Certainly people do come back, and they always laugh because they say, I remember you told me. You'll see me in 15 years. And sure enough, they're starting to show up now. So that's an overview of what you can do, but we have to individualize treatments for people when we see them in the office. So when we talk about, well, which treatment is right for me, it has to do with what the patient is interested in. Is it a medical problem? Do they hurt? Is it simply a cosmetic problem? They want them to look better. Do I have spider veins? Do I have large varicose veins? Do I need an ablation procedure for the saphenous vein under my skin, or a combination of all three? So we individualize what we do. Typical patient comes in, we see this often in women after children. They'll just have isolated spider veins throughout their leg, but their other veins are okay. And this is simply a cosmetic thing. And for these patients, easy to treat in the office with sclerotherapy. This is a patient of mine who This took several months and several treatments. Got to be honest, this is just one side of her leg. Her other leg matched it. It was just as bad. And so this person was motivated. It's a young woman, as you can see. She's got a muscular leg, and she hadn't worn shorts or dresses in years. And so we were able to get her cleaned up to the point where she was comfortable. And what I tell my patients before they start this process is we will make you a lot better. We will not make you perfect. We will not make you 21 again, but we certainly can get you back out in your shorts and your skirts or whatever you like so that you're more comfortable with yourself. This is totally cosmetic. How about this patient? This patient clearly has a major problem with their veins. They need their underlying vein treated, the saphenous vein. These are the vein with those valves that malfunction. So for this woman, we did the ablation procedure. We brought her in, and we do this all at the same time. We numb the skin here in her leg, and then we put that needle in the vein. We introduce the catheter. We travel up the vein here, and we zap it all closed. We take our needle out. A Band-Aid goes on. This area is all numb. We make our punctures, and all those veins are gone. For this leg to go to this leg is an excellent result. If you look closely, and this is what I tell my patients, this skin overlying these veins, this has damaged the skin. And this is probably 3 to 4 months after her procedure. And you can see she does have some discoloration of her skin, and that takes time. That can take up to a year to fade. And some people, they may be able to see some of this forever. But it's a trade-off. You can go from this to this, very easy, minimally invasive, done in the office. So just a word of caution to people. There's a lot of people out there on the internet, on the street corner, advertising in the magazines we get in our house, like 201. Everybody's a vein doctor, and it's a problem. We see a lot of complications. I'm not going to show you pictures of them, but we see complications elsewhere. People come to us for second opinions because this is a science and it's an art. I've been doing this more than 20 years. And so I've, quote, seen it all. And you need to really make sure when you see someone for this problem isn't just varicose veins, anything can be done. This really takes a lot of thought, a lot of expertise, and a lot of experience to make sure it comes out right. This is what happens. People start going down the road to get their varicose veins fixed, and they realize people don't know what they're doing, and it's a real problem. It's gotten to the point where this is a little old. It's from Charlie Crist when he was the Attorney General in Florida. Now, if you know, he's running for governor. But they actually put out a warning to the residents in Florida, because on every street corner in Florida, there's a, quote, vein clinic. And a lot of people were having a lot of complications. So we do take it seriously. You should take it serious when picking a doctor for any of your care, but you should have that same threshold and same bar when it comes to treating your veins. It's a big issue, and it needs to be done right. So at this point, I don't want to lose anyone's attention. I want to see if people have questions. This is my information in case anybody wants to know. This is what we do in the office. These are my partners. These are the guys who take care of all the heavy lifting with the real complicated stuff so that I can help people in the office and fix their varicose veins.